Let's talk a little bit about our subscapularis. It's one of the 4 rotator cuff muscles whose main function is internal rotation of the shoulder from a range of motion standpoint. But other than that, some of its other key roles are it's the only rotator cuff muscle that attaches directly to the front of the shoulder, and it keeps the ball stabilized inside of the socket. So it'll actually take the ball and suck it back into the socket. Another role that it has, because of its positioning on the inside of the shoulder blade, right in between the shoulder blade and the rib cage, is during elevation and overhead movements, it assists in keeping that shoulder blade sucked against the rib cage. So if you've ever heard of scapular winging, or you're one of those guys that's able to pop their shoulder blades off and kind of peel them off of the rib cage, you may have some weakness of your subscapularis, in addition to other muscles, but it does assist in that motion. So one way that I'll test on examination in here, and you can test yourself to see if you have any deficits in this muscle, is through a lift-off test. So what you'll do is internally rotating or reaching behind your back, placing the back side of your palm just on the small of your lower back. We're gonna take our shoulder blade and set that up so that we're not just tilted forward here. Bring it back and down so that we have a nice packed position that way. And then from there, you're going to lift off the back of the hand and hold. And see how long you can hold, 15 to 30 seconds, looking to see what we can get, and then compare to the other side. If you have issues, if you find that you're not able to lift off or you're not able to hold and there's variances from one side to the other, then work on this movement. Work on this lift off, maintaining the shoulder blade position, lift off and build up your endurance. You can do this in standing, or you could also do it lying down, and I'll show you that version tomorrow.